Imagine holding the key to understanding what your body is trying to tell you. Not through expensive tests or doctor visits, but through the subtle language of symptoms that your body speaks every day. Medical diagnostics, at its core, is learning to translate this language. Medical diagnostics is essentially the science of pattern recognition applied to human health. When a doctor hears your symptoms, they're not just hearing isolated complaints. They're listening for patterns that point to underlying conditions. This skill can be learned by anyone willing to develop systematic observation and pattern matching abilities. Begin with the fundamentals. Learn basic anatomy and physiology first. Understand how the body normally functions before you can recognize what's abnormal. Study common presentations. Master the typical ways common diseases present. Chest pain for heart issues, cough for respiratory problems. Practice differential diagnosis. Learn to generate a list of possible causes for a set of symptoms. Understand red flags. Recognize symptoms that indicate immediate medical attention. Here's a fascinating modern dilemma. If an AI can analyze symptoms with 95% accuracy, why do human doctors still outperform them in complex cases? The answer lies in what medical researchers call contextual intuition, the ability to incorporate subtle social, environmental, and emotional cues that algorithms miss. Consider this. When a patient says, "I've been tired lately," a human doctor might notice the hesitation in their voice, the way they avoid eye contact, or the cultural context that makes them reluctant to discuss depression. An AE might miss these crucial contextual clues. This raises an important question for our digital age. How do we preserve the human elements of medical care as technology becomes more sophisticated? Learn to notice subtle details, the precise quality of pain, sharp versus dull, burning versus aging. Timing patterns. Symptoms that worsen at night or after meals. Associated symptoms. When headache comes with nausea versus visual disturbances. Create your own diagnostic reference system. Symptom to disease mapping. Disease to symptom reverse mapping. Risk factor assessment tables. Develop your diagnostic reasoning. Always consider multiple possibilities. Weigh probabilities based on prevalence. Consider rare but dangerous conditions. Essential resources include up-to-date medical textbooks. Start with basics like Bates' Guide to Physical Examination. Reputable online databases like CDC, WHO, Mayo Clinic. Medical journals for latest research. Clinical practice guidelines. Learning methods include case studies. Work through real and hypothetical cases. Shadowing. Observe healthcare professionals when possible. Simulation. Use diagnostic simulation tools. Mentorship. Connect with experienced diagnosticians. Remember that learning diagnostics comes with significant responsibility. Never attempt to diagnose yourself or others without proper training. Always recommend professional medical evaluation for health concerns. Understand the limitations of your knowledge. Maintain humility. Medicine is complex and constantly evolving. The field is rapidly evolving with AI-assisted diagnostics that augment human capabilities. Portable diagnostic devices for home use. Genetic testing becoming more accessible. Telemedicine expanding access to expertise. As you learn, focus on developing both the technical knowledge and the human judgment that will remain valuable even as technology advances. The best diagnosticians of the future will be those who can work seamlessly with AI while maintaining the human touch that makes medicine an art as well as a science. Getting started today. Choose one body system to focus on: cardiovascular, respiratory, and so on. Master the anatomy and basic pathologies. Practice with case studies. Consider formal education or certification if you want to pursue this seriously. Medical diagnostics is a journey of lifelong learning, but every step you take makes you more health literate and better equipped to make informed decisions about your own health and help others do the same. You're not just learning about diseases. You're learning to listen to the story your body is telling, and in doing so, you're gaining a skill that can genuinely help make the world a better place, one informed health decision at a time.
Imagine you wake up tomorrow morning with a persistent headache that won't go away. You reach for your phone and type headache causes into Google, only to be overwhelmed with millions of results ranging from dehydration to brain tumor. In a world drowning in health information, how do you distinguish what's actually important from what's just noise? This isn't just about avoiding hypochondria. It's about developing one of the most valuable skills of the 21st century, medical literacy. We live in an extraordinary paradoxical time. Never before in human history have we had such unprecedented access to medical knowledge and technology. Yet simultaneously, we've never been so vulnerable to misinformation and misinterpretation. The average person is bombarded with health advice from every direction. Social media influencers selling miracle cures, pharmaceutical companies pushing medications, and well-meaning friends sharing articles from questionable sources. The real danger isn't just the occasional bad advice. It's the erosion of our ability to think critically about health information. When we can't distinguish between evidence-based medicine and anecdotal claims, we become vulnerable to exploitation at best and harmful decisions at worst. Medical diagnosis isn't just about memorizing symptoms. It's about understanding the underlying probability and logic. Consider this trending question that's changing how we approach everyday health decisions. If a medical test is 95% accurate and comes back positive for a condition affecting it in 000 people, what's the actual probability you have the condition? Most people would say 95%, but the real answer is dramatically different. Let me walk you through Themeth. Prevalence, in 000 people have the condition, which is 01. Test accuracy, 95%, both sensitivity and specificity. Population, let's use 100 people for easy calculation. Breaking it down, 100 people actually have the condition, which is 01 of 100 99 people don't have the condition. Of the 100 who have it, the test will correctly identify 95% people. Of the 99 who don't have it, the test will incorrectly show positive for 5, which is 5,95 people. So when you get a positive result, you're one of 95 plus 4,95 equals 5,090. People with positive results, but only 95 actually have the condition. The real probability is 95 divided by 5,090, which equals approximately 87. This counterintuitive result is why understanding medical statistics is crucial. It's not just academic knowledge. It's a tool that can prevent unnecessary anxiety, invasive testing, and even dangerous treatments. Developing your diagnostic toolkit, master the art of pattern recognition. Our brains are naturally wired to recognize patterns, but medical diagnosis requires conscious training. Start by practicing with common conditions. Migraine versus tension headache. Migraines typically involve throbbing pain, sensitivity to light and sound, nausea, and last 4 to 52 hours. Tension headaches feel like a band around the head, aramilla, and respond well to rest. Allergic versus viral rash. Allergic rashes appear suddenly, are intensely itchy, and respond to antihistamines. Viral rashes develop gradually, may be associated with fever, and follow a specific pattern. Understand red flags that demand immediate attention. Certain symptoms should never be ignored. Memorize these critical red flags. Sudden, severe headache, worst of your life. Chest pain with shortness of breath. Sudden weakness or numbness on one side. High fever with stiff neck. Unexplained weight loss of more than T in 6 months. Learn the art of the patient history. Doctors spend 80% of their diagnostic time taking histories, and so should you. When evaluating symptoms, ask, onset, when did it start? What were you doing? Duration, how long does it last? Is it constant or intermittent? Quality, describe the pain or sensation in your own words. Severity, on a scale of 1 to 10, how bad is it? Associations, what makes it better or worse? Radiation, does it move anywhere else? Practical applications for everyday life. Home monitoring skills. Learn basic self-monitoring that can save your life. Blood pressure tracking. Normally typically less than 120 or 80 millimeters of mercury. Pulse oximetry. Normal oxygen saturation is 95 to 100%. Blood glucose fasting levels should be 50 to 100 milligrams per deciliter. Medication safety. Always ask these questions when prescribed medication. What is this supposed to treat? How long until I should see improvement? What side effects are common versus serious? Are there any interactions with my current medications? What should I do if I miss a dose? Emergency decision making. Learn to recognize when time is critical. For example, with stroke symptoms, remember fast, face drooping, arm weakness, speech difficulty, time to call emergency services. The future of personalized medicine. We're entering an era where AI and big data will revolutionize healthcare, but human judgment remains irreplaceable. The best approach combines technological tools with human intuition. Consider how wearable devices are changing our relationship with health data. A smartwatch might detect atrial fibrillation, but it can't interpret the clinical context. That's where your diagnostic skills come in, understanding when to trust the technology and when to question it. Building your medical knowledge base. Start with these authoritative resources. CDC's Travelers' Health, the gold standard for travel medicine. Up to date. Evidence-based clinical information for professionals. Melscape. Clinical reference tools and case studies. WHO International Classification of Diseases, the standard for medical coding. Remember that knowledge without application is useless. Start small today. Learn to interpret your own lab results.
Practice taking a thorough medical history with family members. Study common drug interactions. Master the language of medicine. Prefixes, suffixes, root words. Medical literacy carries ethical responsibilities. When you understand health concepts better, you become a steward of not just your own health, but your families and communities. Share knowledge wisely, distinguishing between helpful information and dangerous speculation. Medical diagnostics is more than just a medical skill. It's a life skill that empowers you to navigate an increasingly complex health landscape. By understanding probability, mastering pattern recognition, and developing critical thinking about health information, you're not just protecting yourself, you're becoming an active participant in your own healthcare. The next time you face a health question, remember that you have the tools to think through it systematically. This isn't about replacing doctors. It's about complementing their expertise with your...
The hidden language of health statistics, how to decode medical information like a pro. Imagine you're told a new screening test is 99 accurate. Does that mean you can trust the results completely? Most people would say yes, but the real answer might shock you. This type of misunderstanding costs lives and billions in unnecessary treatments every year. In today's information age, we're constantly bombarded with health claims, medical studies, and statistical pronouncements. From breakthrough cancer cures to miracle supplements, the health landscape is saturated with numbers that sound impressive but often mislead. Medical statistics literacy is the ability to critically evaluate health claims, understand medical research, and make informed personal health decisions. This skill is surprisingly rare. Studies show that even healthcare professionals struggle with statistical reasoning in some contexts. The foundation of understanding medical statistics begins with basic statistical concepts that most people never learn in school. Relative versus absolute risk is one of the most important distinctions. Many health reports use relative risk reduction because it sounds more dramatic than absolute risk reduction, telia. For example, a drug might reduce your risk of heart attack from 2 to 1. This is a 50 relative risk reduction, which sounds impressive. But it's only an absolute risk reduction, which is much less dramatic. Another critical concept is sensitivity and specificity, the test accuracy trap. When we hear a test is 95 accurate, most people assume it's reliable, but accuracy can be misleading. Sensitivity refers to how well the test detects people who actually have the condition, known as the true positive rate. Specificity refers to how well the test correctly identifies people who don't have the condition, known as the true negative rate. A test can be 95 accurate, but have very poor sensitivity or specificity depending on the population. This brings us to what might be the most important statistical concept for health decisions, Bayesian thinking. Medical tests aren't perfect, and results need to be interpreted in context. This is essentially how we update our beliefs based on new evidence. Here's a question for thought. If a disease affects 1,000 people in the population, and a test for this disease has 95 sensitivity and 90 specificity, what's the probability you actually have the disease after you test positive? Most people guess around 90, 95, but the real answer is shockingly low, only about 8. This counterintuitive result shows why we need to understand base rates and test characteristics. It's why even accurate tests can give misleading results when used on general populations. There are several common statistical fallacies in health reporting that you should watch out for. First is correlation versus causation. Just because two things happen together doesn't mean one causes the other. Second is cherry-picking data, where researchers highlight only the results that support their claim while ignoring contradictory evidence. Third is small sample sizes. Studies with few participants are more likely to show extreme results by chance. Finally, there's publication bias, where positive results are more likely to be published than negative ones. The practical applications of medical statistics literacy are numerous. When evaluating medical studies, you should ask several key questions. What was the sample size? Was it a randomized controlled trial? What were the primary versus secondary outcomes? Who funded the research? What are the absolute versus relative benefits? Understanding risk communication is another crucial application. Health risks are often presented in ways that exaggerate or minimize danger. Learning to spot these manipulations helps you make better decisions about your health and healthcare. Building your medical statistics literacy takes practice but is incredibly valuable. Start with the basics by learning key statistical concepts like confidence intervals, p-values, and effect sizes. Practice with real examples by analyzing health news articles and identifying statistical claims. Use critical thinking frameworks by developing questions to ask when evaluating health information.
Finally, consult multiple sources. No single study tells the whole story. In a world where health misinformation spreads faster than ever, medical statistics literacy isn't just useful. It's essential for making informed decisions that can literally save lives. This skill empowers you to cut through the noise and make choices based on evidence rather than hype.
Imagine being able to diagnose a life-threatening illness with just a patient's symptoms and a simple blood test. No MRI machines, no CT scanners, no advanced laboratory equipment. This isn't science fiction. It's the reality of tropical medicine, where doctors in remote clinics across Africa, Asia, and South America save lives every day using diagnostic skills that could disappear within our lifetime. Tropical medicine focuses on diseases that thrive in warm, humid environments, places where millions of people live without access to advanced healthcare infrastructure. When malaria strikes a child in rural Kenya, when dengue fever spreads through a Southeast Asian village, or when Chagas disease affects communities in Latin America, the first responder is often a local clinician who must diagnose and treat with limited resources. These diseases don't stay contained. Global travel means a case of Zika diagnosed in Brazil could appear in Miami next month. Understanding tropical diagnostics isn't just about helping distant communities. It's about protecting global health security. Before we dive into specific diseases, let's explore the foundation of all good diagnosis: clinical observation. In tropical medicine, you learn to see what others miss. Different tropical diseases have distinct fever patterns that can be diagnostic clues. Malaria often presents with cyclical fevers. Every 48 hours for Plasmodium, Vivax, and Ovale, or 72 hours for Plasmodium falciparum. Dengue typically shows a saddleback fever pattern. High fever for 5 days, then drops temporarily before rising again. Typhoid presents with a steady, rising fever over several days. Brucellosis causes undulant fever that waves up and down for weeks. Here's where math meets medicine in fascinating ways. If a diagnostic test for malaria has 75 sensitivity and 70 specificity, and the prevalence of malaria in your clinic population is 20, what is the probability that a patient with a positive test actually has malaria? This isn't just academic. Understanding these numbers helps you avoid both missing true cases and overtreating healthy patients. The answer reveals why even accurate tests can be misleading in low-prevalence settings. Mastering key diagnostic skills begins with blood film examination. The gold standard for many parasitic diseases remains the thick and thin blood smear. Learning to identify Plasmodium species in red blood cells, trypanosomes in lymph fluid, microfilariae in night blood samples, and Babesia parasites combines art and science. You need to recognize subtle morphological differences that distinguish deadly diseases. In resource-limited settings, rapid diagnostic tests or RDTs are revolutionary. These lateral flow tests work like pregnancy tests but can detect antigens from malaria, parasites, antibodies to dengue virus, Helicobacter pylori in stomach ulcers, and HIV antibodies. Learning to interpret these correctly, understanding false positives and negatives in your specific setting, is crucial. Tropical medicine relies heavily on decision trees. For example, the Integrated Management of Childhood Illness algorithm helps community health workers assess danger signs, classify illnesses, and treat or refer appropriately. Mastering these algorithms means you can provide life-saving care even when you're the only healthcare worker for miles. Essential resources include textbooks like Manson's Tropical Diseases and Hunter's Tropical Medicine, online courses such as WHO's Open Learning modules on neglected tropical diseases, field guides like the CDC's Yellow Book for Travel Medicine, and journals including the American Journal of Tropical Medicine and Hygiene. Practical skills development starts with microscopy practice using online image libraries to identify parasites. Join tropical medicine societies to access case discussions and continuing education. Consider fieldwork. Many organizations need volunteers for short-term projects, and learn epidemiology to understand disease transmission, which helps with diagnosis. As climate change expands the range of vector-borne diseases, tropical medicine skills become increasingly valuable. New technologies like CRISPR-based diagnostics, portable DNA sequencers,
AI-powered image analysis and telemedicine consultation platforms are revolutionizing how we diagnose diseases in remote settings. However, the fundamental skill remains the same: the ability to think critically about clinical presentations and apply knowledge systematically. Every year, tropical diseases affect over 1 billion people and cause more than 500,000 deaths. Many of these deaths could be prevented with better diagnostics. By learning these skills, you're not just acquiring medical knowledge, you're gaining the ability to save lives in some of the world's most vulnerable communities. The doctors who mastered tropical disease diagnostics during the Ebola outbreak in West Africa didn't have fancy equipment. They had knowledge, observation skills, and the ability to think systematically. Those skills saved countless lives. Getting started today is simple. Read one chapter from a tropical medicine textbook this week. Practice identifying common parasites using online image databases. Follow epidemiological updates from WHO or CDC. And consider volunteering with organizations like Doctors Without Borders. The journey to mastering tropical medicine diagnostics is challenging but incredibly rewarding. You'll gain skills that could help save lives anywhere in the world, and you'll join a global community of healthcare workers dedicated to health equity. Remember? In tropical medicine, sometimes the most advanced diagnostic tool is a well-trained clinical mind and the willingness to look closely at what others might overlook.
Learning to learn. Mastering the art of wound assessment. Imagine being able to look at a simple cut and understand not just what you see, but what lies beneath the surface, how deep it is, which structures might be damaged, and how long it will take to heal. This isn't just for doctors. It's a skill that could help you provide better care in emergencies, make more informed decisions about when to seek medical help, and even save lives in situations where professional medical care is hours away. Wound assessment is a fundamental skill in medicine that combines observation, knowledge of anatomy, and understanding of healing processes. When done correctly, it helps determine the severity of an injury, guides treatment decisions, and predicts healing time. Wound healing is a complex biological process that typically occurs in 4 overlapping phases: hemostasis immediate, blood vessels constrict, and platelets form a clot to stop bleeding. Inflammation first few days. Blood vessels dilate, immune cells flood the area to clean debris. Proliferation days, 2, 2, 1. New tissue and blood vessels form. Maturation weeks to months, scar tissue strengthens and remodels. The time it takes for a wound to heal depends on many factors, but a simple formula can help estimate healing time for uncomplicated wounds. Healing time days, 3 depth, 14. This means a isang deep cut might take about 17 days to heal completely, while a 5 deep wound could take 29 days. Here's a fascinating question that combines mathematics, biology, and practical application. If you have 2 wounds, one that's 3 deep and 2 centimetro long, and another that's 1 tuldok, 5 deep and 6 centimetro long, which one will heal faster according to the healing time formula, and why might this surprise you about how we perceive wound severity? Think about this carefully. Most people would assume the longer, more visible wound is more severe. But the healing time formula tells us depth matters more than length. A 3 deep, short wound will take approximately 23 days to heal 3-14, while the shallower but longer 1 tuldok 5 wound will take about 18 tuldok 5 days 3, 1 tuldok 5-14. This counterintuitive result teaches us that our perceptions of severity don't always align with biological reality. When assessing a wound, follow these key steps. Clean the area gently with saline or clean water. Measure depth using sterile instruments if available. Check for contamination, dirt, debris, or foreign material. Examine edges. Are they clean or jagged? Look for signs of infection, redness, swelling, warmth, pus. Check surrounding tissue. Is there damage to deeper structures? You should seek medical attention for wounds that are deeper than limam,
won't stop bleeding after some 2 minutes of direct pressure, have jagged edges or gaps that won't close, show signs of infection, are in cosmetically important areas, face, hands, result from animal bites or dirty punctures. Start by practicing on minor injuries with permission or using educational models. Focus on developing your ability to estimate depth accurately, recognize signs of infection early, understand which structures might be involved, make appropriate recommendations for care. Mastering wound assessment isn't just about individual care. In areas with limited medical access, this skill can prevent complications, reduce scarring, and even prevent life-threatening infections. It empowers ordinary people to provide better care in emergencies, whether it's at home, on the playground, or in disaster situations. The next time you see a wound, don't just see the surface. Look deeper. Understand what you're seeing, know what it means, and recognize that this simple skill could make a real difference in someone's recovery journey.
Imagine being able to look at a simple cut and understand not just what you see, but what lies beneath the surface, how deep it is, which structures might be damaged, and how long it will take to heal. This isn't just for doctors. It's a skill that could help anyone from parents on the playground to volunteers in disaster situations. The next time you see a wound, don't just see the surface. Look deeper, understand what you're seeing, know what it means, and recognize that this simple skill could make a real difference in someone's recovery journey. Wound assessment is the systematic evaluation of injuries to determine appropriate treatment and predict healing outcomes. Every year, millions suffer wounds that range from minor cuts to severe injuries. Proper assessment can prevent infections, determine when professional help is needed, guide appropriate first aid, and help track healing progress. Wound healing occurs in 4 phases: hemostasis, where blood clots form; inflammation, where white blood cells clean the area; proliferation, where new tissue forms; and maturation, where tissue strengthens. Understanding these phases helps us assess healing progress. Different wounds require different approaches. Incisions are clean cuts, lacerations are jagged tears, abrasions are scrapes, puncture wounds are small, deep holes, avulsions are torn away tissue, and burns are tissue damage from heat or chemicals. Location matters because some areas heal faster than others. Here's an interesting math question for wound care. How do you accurately measure a wound's surface area when it's irregularly shaped? Traditional methods fail for complex wounds. Use the grid method. Overlay a transparent grid with known square dimensions and count the squares more than half covered by the wound. For partial squares, estimate the fraction covered. For a wound covering 47 full squares and 12 partial squares that average about 6 coverage, total area equals 47 plus 12 times 8 which equals 47 plus 7 giving us 54 square centimeters. This method provides accuracy within about 5 of the true area, making it reliable for tracking wound changes. Healthy wound beds should have granulation tissue, red or pink bumpy tissue showing healing, clean edges with no spreading redness, and appropriate moisture. Warning signs requiring medical attention include slough, yellow, tan, or greenish dead tissue, eschar, black or brown dead tissue, purulent drainage, thick colored discharge, and foul odor. Blood supply is crucial for healing. Assess capillary refill. Press beside the wound and note how quickly color returns should be less than 2 seconds. Check for nearby pulses, note temperature differences, and watch for color changes like pale, blue, or darkened tissue indicating poor circulation. Early infection detection can prevent serious complications. Increased pain, swelling, redness, warmth, fever, chills, fatigue, swollen lymph nodes, delayed healing, increased drainage, or new spreading redness. For assessment, start with safety. Wear gloves, clean the wound gently if safe, and control bleeding.
Then, inspect the wound type and location, check for foreign objects, and examine surrounding skin. Next, take detailed measurements, length, width, and depth using a clean ruler, assess tissue types, check for infection signs, and evaluate surrounding tissue. Finally, document everything: date and time, wound type and location, measurements, tissue findings, drainage or odor, and pain level on a 0 to 10 scale. Seek professional help for wounds deeper than a quarter inch, longer than half an inch, in sensitive areas like face, hands, feet, or joints, showing infection signs, not healing within 7 to 10 days, from animal or human bites, or when you're uncertain about proper care. For simple cuts and scrapes, clean with mild soap and water, apply antibiotic ointment, cover with sterile bandage, change daily or when wet, and monitor for infection signs. Advanced assessment includes the rule of tens. Wounds under 10 millimeters usually need minor care. 10 to 25 millimeters need moderate care with close monitoring, and over 25 millimeters likely need professional attention. For immobile patients, the Braden scale assesses sensory perception, moisture, activity, mobility, nutrition, and friction or shear. In disaster situations, rapid wound assessment helps triage patients, prioritize limited resources, prevent preventable complications, and identify those needing immediate surgical intervention. In everyday life, parents, teachers, and community members can provide better first aid, know when to seek help, assist in emergencies, and monitor healing progress. In workplace settings, proper assessment prevents infections from workplace injuries, ensures appropriate treatment, documents injuries for workers' compensation, and identifies accident patterns. Common mistakes to avoid include ignoring surrounding tissue, overestimating or underestimating depth, missing infection signs, not documenting changes, and applying inappropriate treatments. The future includes digital imaging with smartphone apps that measure wound area and track changes, smart bandages that monitor wound conditions and send alerts, AI-powered analysis using computer vision to detect early infection signs, and telemedicine for remote assessment by healthcare professionals. Wound assessment is more than looking at a cut, it's understanding the story beneath the surface. By developing these skills, you can provide better care, make informed decisions about when to seek help, and potentially prevent serious complications. When you encounter a wound, remember your assessment could be the difference between quick recovery and serious complications. Take time to look closely, understand what you're seeing, and apply your knowledge. This simple skill could make a real difference in someone's life.
Imagine being able to look at a mole and know with 95% accuracy whether it could be deadly, all without a biopsy. This isn't magic, it's the science of dermoscopy, where dermatologists use specialized magnification to see beneath the skin's surface and detect melanoma years before it spreads. Dermoscopy, or dermatoscopy, is a non-invasive technique that uses a handheld device with 10 to 20 times magnification and polarized light to examine skin lesions. When you look through a dermatoscope, you're not just seeing the surface, you're viewing the colors, structures, and patterns that live beneath the epidermis, revealing details invisible to the naked eye. For decades, we've been taught the ABCDE rule for melanoma detection: asymmetry, border irregularity, color variation, diameter greater than 6 millimeters, and evolving appearance. But modern dermoscopy has evolved beyond these basic criteria. Today, dermatologists use structured pattern analysis that examines global features like color and pigment networks, plus local features like streaks and blue-white veil. Here's a fascinating twist on traditional math. If you have 100 moles and use the ABCDE method, your sensitivity for detecting melanoma is about 92%. But with dermoscopy pattern analysis combined with ABCDE, sensitivity jumps to 98%. However, dermoscopy also increases false positives by 15%. If the prevalence of melanoma in your population is 2%, and you screen 10,000 people using dermoscopy, how many true melanomas will you miss compared to using just the ABCDE method? More importantly, at what point does the additional accuracy of dermoscopy justify the increased false positives and potential unnecessary biopsies? Start with a non-polarized dermatoscope. These work well for beginners. Apply contact fluid